My name is Eline Coppens and I've worked as a clinical psychologist and psychotherapist at the Leuven Pain Center in Belgium for the last 6 years. Together with 2 other colleagues, I'm involved in the assessment and treatment of chronic pain patients. As a global framework, we use the Acceptance and Commitment-Based Therapy, or ACT model. This is an empirically based psychological model used in the treatment of pain patients. In a multidisciplinary context of care, we use ACT interventions to increase psychological flexibility and change. As psychologists, we act as case managers from a biopsychosocial perspective, responsible for the day-to-day psychosocial care of the patient. As a clinical psychologist, I'm involved with chronic pain patients at 4 different stages: diagnosis, pain education, counseling about motivation to change, and psychotherapy and psychological treatment. The first stage that I'm involved in is diagnosis, and more specifically the medical assessment of a chronic pain patient. This assessment is carried out along with an anesthesiologist and rehabilitation specialist, who see the patient first. I then carry out a psychological assessment using a semi-structured interview where I ask questions to try and understand about the pain problem and how long they've been struggling with it. This includes a description of the pain, their life history and current life context, feelings about the pain, symptoms of depression, anxiety, anger or frustration, coping strategies and previous life values versus their current ones. This can also help to tell us about psychiatric comorbidities. The semi-structured interview works well as it means we can gather a lot of information quickly and allows the patient to lead and focus on the things they want to talk about, which can also enhance their confidence. I'm also involved in educating the patients about the psychosocial aspects of pain. This includes information on pain pathways, emotions and coping style, the role of depression, anger and anxiety, how to live better with pain, balancing rest and activity, relaxation-based strategies, assertive communication, asking for help in daily life activities, and the importance of life values despite pain. It's important that patients understand these aspects of pain so they fully appreciate the further multidisciplinary care and rehabilitation model. An important concept that we try to teach patients is the concept of acceptance. This means that patients learn to accept phenomena that they have and cannot control, such as pain sensations, thoughts, worries and fears about pain. Instead, they learn to put their energy into phenomena which they can control, such as their behavior. At the end of this education phase, the team, which is made up of a rehabilitation specialist, nurse and psychologist, meet with the patient to discuss their perspective and a plan for further rehabilitation. This meeting helps us to emphasize the importance of their active role in the rehabilitation process and gives them a better sense of control. After the education phase, a lot of patients have specific needs and we offer support to allow them to take responsibility for their own rehabilitation plan. The patient takes the lead and rehabilitation staff follows, providing support when asked for. A subgroup of patients chooses to take part in what we call the Multidisciplinary Rehabilitation Program at our center. This is the next stage, where patients are managed by a range of disciplines and undergo treatment plans that consist of physical exercise, relaxation exercises and group psychotherapy. As a psychologist, I take care of the group psychotherapy, where patients have the opportunity to learn from each other. Patients often accept more difficult messages from each other than from the therapist or healthcare provider. Therefore, we believe group psychotherapy is a very important instrument in creating a more fundamental change in the patient. In group psychotherapy, we try to understand how our mind and the way we interact with others can change body experience. These sessions often enhance the motivation of the patient to start an individual psychotherapy process. Chronic pain has both physical and psychological aspects, so it's important to use different treatment approaches at the same time. One single treatment approach is often ineffective. In pain treatment, using different components together, such as medication, physical exercise, and psychotherapy, can be the difference between success and failure. In a typical medical model, a doctor may first offer a patient a monodisciplinary medical treatment approach, and if this strategy doesn't work, they may then send the patient to the psychologist. This model can reinforce the patient's belief that the healthcare team don't fully understand their pain or believe them. This isn't an elegant starting point for the psychologist, so we think it's very important to develop a multidisciplinary diagnosis and hypothesis of treatment and rehabilitation.